So a lot of our patients are curious, what sets you apart from other doctors in the area? Why are you different and better than the chiropractors, physical therapists, pain management specialists that I've seen already? They haven't been able to do anything for me. What makes you different? And the difference is in our approach. We do very specific treatment to patients, and because of that, we qualify them. We want to know that you and your issue are going to be resolved by our approach. So the first step of this process is a consultation. You'll have a brief conversation with our office manager to get some general history out of the way, and if you qualify with her, then you get to have a talk with a soft tissue specialist, such as myself. At that meeting, you'll fill out the intake paperwork, and you and I will have a discussion about that, having the detailed history, any gaps you may have left out filled in, and then I come up with a list of potential reasons why you could be injured. So that's our differential diagnosis. We come up with several possibilities. So we kind of narrow our scope and say, do you qualify? Is this something that we can fix? If it's not, we'll tell you, and we'll say, I don't think you're really a quality candidate for what we do, and we'll say that and send you on your way. But if you are, then we move on to the exam phase. In the exam, we'll do some things that you're familiar with, such as strength, sensory, reflexes, seeing how generally, how well your nerves are functioning and if you have enough strength and whatnot. But what sets us apart really is our orthopedic tests and functional assessments. This is where we specifically measure function as well as, rule in or out other more serious damage. So we can say how much function is in your hip, how much in hip flexion, hip extension, lumbar flexion, knee flexion, whatever it is. We'll be able to say, this is how much range of motion or function you should have. Here's how much you have. And then using all of this data, we're going to come up with the specific diagnosis that says, hey, 80% of this is due to adhesion or scar tissue, 20% of this is due to cartilage degeneration. There is a chance you have this or that other complicating factor, but I think we can get you to 80, 90% better, maybe more, depending on your load management. If you like those odds of success and the likelihood that you're going to improve, then we can continue with the treatment phase, which will essentially be the same thing every time. This exam is going to take 30 to 45 minutes. Treatment appointments are 10 to 15 minutes. And they will include the same thing every time because what we're looking for is objective measurements. It's going to be the same regimented routine each time, so we know that we are making progress. We'll take your history since the last time we saw you. Is there any relevant activities or postures that made what you did or how you feel better or worse? We'll do the functional test that is the most directly correlated with your injury. We'll take a measurement of exactly how many degrees or how many inches of range of motion you have. We'll take a note of what you're feeling as we're doing it. Then we will treat the affected tissues that are limiting that functional test. Immediately after treatment, we retest so you can see and feel the improvement immediately. Once you have gotten a certain measure of health back, then we will, and only then, will we consider adding a strength component to your care. Because ultimately, if this injury was gained from overuse, which is incredibly common, what is giving more use to your overuse injury going to help with? It's going to make things worse and even be detrimental and really slow progress to a standstill. So this part only gets considered when and if you don't pass a strength assessment and you are a certain amount of health has been regained. But this is our approach. You will be able to see and feel improvement as we go, and everything is incredibly transparent for the patient. So you know exactly what you're getting and how while and how long it's going to take for you to return to health. So if this sounds logical and this sounds like something you'd like to be a part of, I suggest you give us a call. You might qualify for what we do. Thanks.